recorded. So please know that. We ask everyone to use the chat feature in order to ask for technical questions and issues. If you have questions regarding the Minnesota Health Plan or anything regarding content tonight, please use the Q&A feature at the end in your bar at the bottom of the screen. And I'm going to hand it over to Ann Jones.
Thanks, Judy. Just a quick description of what we're planning for this evening. So you've heard Judy and Jen are our hosts for this evening. I'm going to quickly go over the agenda, and I will actually wait on context for the issue of how we pay for healthcare until we've heard from our legislators whose time is very precious this evening. We'll talk a little bit about economic and justice imperatives for our work. After that, Ken's going to talk about our work in building a coalition of like-minded organizations to run a campaign for a bill. Very soon, I will turn it over to Rose Broach, Executive Director of M&A and a board member for Healthcare for All Minnesota, to introduce Minnesota Health Plan Legislative Caucus, who we are so excited to welcome this evening. After we've heard from our legislators, there will be time for a few questions and answers as they are available. I'll talk a little bit after that later on about the Minnesota Health Plan and building grassroots support. Ken, if as time allows, may have a few minutes to remark on recent events in California, another state that's working on a state-based proposal for fixing how we pay for healthcare. At the very end, we'll talk about announcements and a couple of calls to action, and then a wrap up. So let me right now turn our evening over to Rose Broach to introduce our legislators, leaders of the Minnesota Health Plan Legislative Caucus. Rose?
Yes, thank you so much, Ann, for that introduction. So in 2018, 70 congressional members formed the Medicare for All Congressional Caucus for purposes of advancing a national single-payer healthcare system. The members of that caucus prioritized single-payer when they were a candidate and as elected officials to build the necessary political power inside the Capitol in Washington, D.C. Now let's fast forward to 2022. 59 Minnesota state legislators have formed the Minnesota Health Plan Caucus, which, quote, aims to advance legislation that would reduce costs, expand coverage, and guarantee health care for all Minnesotans. These dedicated and focused legislators want to work with us, the grassroots movement, to build political and people power outside the Capitol to create the healthcare system that we all deserve. In this month dedicated to Black history, I want to raise up how racial health disparities are but one example of structural racism, which in and of itself negatively impacts health. As Senator Omar Fateh, an MHP caucus leader who is here with us tonight, has said, quote, healthcare justice is a major factor in establishing racial and economic equity for our state. When it comes to healthcare outcomes, there are unacceptable disparities between BIPOC Minnesotans and their white peers. Under our current employment-based healthcare system, working people are often left behind due to poor coverage and high out-of-pocket expenses. The Minnesota Health Plan is the best way to ensure that every Minnesotan is guaranteed healthcare as a human right, regardless of employment, status, or income. Amen. Healthcare justice is racial justice. I think we all know that we're experiencing a real moment in history, a moment that converges crisis with opportunity, not only in healthcare, but with so many other issues that connect us to our humanity: climate, immigration, racial justice and equity, the corporatization of precious natural resources like farming, the repeal of voting and civil rights, and many more. But I would offer that health is the issue of intersectionality. We know that health outcomes are directly related to social determinants of health, so working together to ensure we all have guaranteed affordable access to care allows us the freedom to be bold, to be active, and to be committed to one another to change the trajectory we're on towards the arc of justice and equity that Dr. King so eloquently envisioned for all of us. I want to ask all of us to be fearless and visionary and committed, just like these legislators, and work with them to ensure passage and implementation of the Minnesota Health Plan. So without further ado, I will turn it over now to our distinguished healthcare justice legislative leaders. Thank you.
Thank you so much for that warm introduction, Rose. Every time I hear Rose speak, I almost get tears in my eyes listening to her because she's such an inspiration, and she hits all of the points that are just so important when we're talking about these issues. That just, it's really inspiring to listen to you, Rose. Thank you so much for that warm introduction. Yeah, it is such a pleasure for all of us to join in this meeting tonight and to talk with you a little bit about the work that we're doing with the Minnesota Health Plan Caucus that we are leading and that we've formed with our colleagues in the legislature this session, and to talk about our vision going forward for what we're going to be doing together and how we're going to accomplish the Minnesota Health Plan for all Minnesotans. So with that, I'm State Senator Jen Mcewen. I represent Duluth in the Minnesota State Senate, and this is my first my first term as a legislator and as an elected official. In fact, I hadn't held office before I ran for the state Senate. And so this is my second session, had last year and now this year. And I ran on this in part, I ran on the Minnesota Health Plan because people in my community had already been working on this and had educated me about this and the possibility of it at the state level. And I had, of course, been following the Medicare for All work at the federal level too. So I knew coming into my work at the legislature that I really wanted to come together with my colleagues and with all of the activists and organizers around the state to push this forward and to really move it. That was one thing that I really campaigned on and that I feel really strongly about. So, but with that, I'll pass it on to my colleagues here too to introduce themselves, and then I think we can talk about our plans.
Well, I'll go next because I see myself on the screen next to Senator Mcewen. I'm Representative Liz Ryer, also a first-term representative from Eagan, Minnesota, District 51E. And you know, it's interesting to think about being here. I'm really grateful to the organizers. I'm especially grateful when I look down and I see 105 participants in this call. And I think about how important this is that all of you are here to spend an evening thinking about this and working for this. That's our shared goal. And you're putting your time in. And so I thank you so much for being here. My background in healthcare goes back to many years working in the payer side of it, both for a healthcare company and then as a consultant in the industry. And so I know from the inside out the complexity of the administration, the complexity and the competing agendas that exist just by virtue of making healthcare that kind of business. Even more, it's a business that was designed with employers in mind and not with patients and people in mind. And we see the impact of that every day. So when we talk about creating an elegant system, a simple system, a people-focused system, there are just some fundamental shifts that we have to make. And I'm excited to be working on that and moving forward with my colleagues and with all of you.
Awesome. I guess I'm going to go next, if that's okay. Hello, everyone. My name is Senator Omar Fateh. I represent South Minneapolis, District 62. I first want to say thank you all from Minnesota Nurse Association, Healthcare for All of you that are joining on tonight. I'm really energized and excited to see all of you and It's it feels good to see that we have such a strong team coming together and so much support to help make this reality. So I want to say thank you for all the work that you all are doing and for your support. I want to first take a moment to acknowledge that we are in February and it is Black History Month, as Rose mentioned. And it's not only important that we celebrate the positive moments of Black history, but the historical injustices that that occurred under our healthcare system, in which it was founded on. In the 19th century, we had the pseudoscience of phrenology used as a justification for slavery. In the 20th century, we had unethical medical experimentation on black people, specifically the Tuskegee experiment, in which Black people were denied the treatment of syphilis long after there was a cure found, denied treatment for that. And today we have massive disparities between healthcare outcomes for Black and white Americans under this for-profit healthcare system, which is just immoral. So the passage of the Minnesota Health Plan is really a restorative justice project. We can not only work to eliminate the disparities that we see today, but begin to repair the generations of harm, trauma, and broken trust by guaranteeing fundamentally high quality healthcare to everyone as a human right. All of us here have the power to be agents for that change, agents for restorative justice. But we must always continue to examine ourselves and strive to approach this work through an anti-racism lens. So I just want to say once again, thank you all so much for having me, for having the team, for listening to all of us, and collaborating to make this a reality. So thank you so much. I'll pass it to Liz Bolden, Representative Liz Bolden.
Thank you so much. So I am Liz Bolden. I represent a portion of Rochester, also in my first term and now second session. And I think it's notable, I think we all are, all four of us are in our first term. So I just want to also just thank all of you. I see 112 participants on my screen. That is amazing. And I just think really speaks to you and your dedication and interest and passion for this. And I think that's fantastic. I also just want to take a moment to recognize for anyone who is working in healthcare right now, and especially, on the patient care side, to just say from the bottom of my heart, a thank you, and to recognize how hard that is and has been for coming up on 2 years now. And so thank you for all you do. My background outside the legislature is that I'm a registered nurse for coming up on 20 years. And that really drives, much of my, the reason that I am behind the Minnesota Health Plan, because I have cared for far too many patients who, ended up in my ICU bed because they didn't have access to care for preventable things that should not have led them to be there. Patients who, ended up in the ICU after having a stroke because they couldn't afford their blood pressure medication. Patients who ended up in my ICU with a brain abscess because they couldn't afford to go to the dentist. There's far too many stories like that. And it just doesn't have to be that way. And so, as Senator Fateh said, this is a moral issue. I firmly believe that. There are lots of reasons why this absolutely makes sense. But to me, the bottom line of that is it is the right thing to do. Everyone deserves care. Everyone deserves to have access to quality, affordable care that they need. And we can do that. It is possible. And so I'm really excited to be in this work and partner with all of you. I also just want to underline what Rose said about sort of the intersection of the moment that we are in. I think we are sort of in an intersection of multiple crises. And I think that creates an opportunity. And I think we're seeing that. I think, as evidenced by 113 people being on a Zoom call on a Thursday night talking about this, we are in multiple crises, and now is the time. And so I do feel like we're in it. It feels different. We're getting momentum. More and more people are starting to see this is necessary and possible. And so I'm really heartened because I think we are pushing forward and moving forward, and we're going to get there. I'm super excited to work with all of you. Maybe, I don't know, Senator McEwen, should I pass it back to you?
Well, sure. I think we could probably just sort of talk. I think the way we talked about this is, I think people are curious. We know about sort of how we see this work going forward. We had some sort of foundational questions about how we see the legislative strategy coming together. Like, what are some of the ways, the paths that we want to work toward? And also questions about how people who are wanting to work on this, what do we think are maybe some of the most effective ways to move it forward? So those are just some of the foundational issues that we know that people wanted to hear from us on, so we can talk about that. And I think Representative Bolden has some exciting news about one piece of our strategy. So I'll just pass it back to you if that's okay, Liz.
Yeah, absolutely. So just sort of the reality of our situation, in Minnesota is that we, currently have a divided legislature. So with a Democrat-controlled House and a Republican-controlled Senate, that just, poses some challenges of, getting things ultimately passed and across the finish line. And so that's just the reality of where we are. However, I have good news to share. I think that is, and speaking of that momentum, it is absolutely moving us in the right direction. So I am carrying a bill in the House, and Senator Marty is the author in the Senate of a bill, not the Minnesota Health Plan bill, but it's a bill to create and fund a study, essentially, to study the financial impacts and the sort of a cost comparison of Minnesota Health Plan to our current system, which is and that bill will be heard in the Health Committee on Monday afternoon, which is really, really exciting because it is the first step towards, or the next step in moving us in the right direction. And so, some of the pushback that we hear is, oh, it's, we can't afford it, it's going to be so expensive. So we know that the equation works. It works. It is much more cost effective to implement the Minnesota Health Plan, to provide care for everyone, to have that social safety net. It pays dividends in many, many different ways. We know that to be true. So let's have that conversation. Let's find out. Let's study that. Let's put numbers on the table so we can sort of pass over that argument, which we know isn't really the case. And so hopeful that we can get the study done so we can really have that full and honest conversation about what the cost benefit actually is. So very excited to have that heard on Monday.
Yeah, it's really exciting news. We were all really very happy to hear that. Really great. And I think that, in our discussions together too, with Senator Marty, who is the author of this bill, originally has been fighting for it, as all of you know, for years, and wrote a book about it and is its longest champion. We've talked about, ideally, if we were able to move this and get this study done soon, that to build this momentum, I don't know, we're hopeful that maybe perhaps what we're talking like a 5-year type of plan, it is the real hope. And it is an uphill battle. All of us know that. And but we also have seen amazing work done in the past where things have sort of a switch has been flipped. And we saw that with marriage equality in the state of Minnesota, where we saw things moving in a negative direction, in fact. And then a lot of wonderful grassroots organizing work was done. And all of a sudden people were ready to go in a positive direction and quickly with some urgency. So we're hoping that we have the right kind of momentum right now at this time too, coming through this pandemic and everything that we've been through together. And I do think that it is notable that the four of us, as new legislators, decided to step up into the leadership role in the formation of this caucus too. And I think it not only does it speak to just our own enthusiasm for this, but we were elected from constituencies who are also excited about this and wanting to see this kind of movement move forward. So I think that there is a sort of conjunction happening right now of some key pieces that could really get us that momentum that we need.
So one of the things that I'm really excited about, and I'm going to piggyback off of what Senator McEwen said, is talking about the grassroots work that happened around marriage equality. And I was thinking about how powerful it would be if all of us were going out and talking to our neighbors about our healthcare experiences. And because everybody I've ever talked to has a story about their own family, about someone they know and love who's had a problem with healthcare, and bringing it and making it personal is the way, in my opinion, to drive the tide of demanding change. And I think that can happen then. We saw it with marriage equality, and there's so much more othering there than there is with healthcare, and it still worked. And so I really think that's a powerful step. And yeah, we've talked about going out and having community events, and I think that's important too, because you want to have the celebratory and the coming together and the being united in the vision of what we can accomplish. I just want to add about talking to legislators. I'm really interested in all of the outstate legislators, and I think someone put a question in the box about that they're on the other side of the aisle from the four of us, but their constituents are suffering under bad health care. To me, one of the most powerful things is to go in as an informed person and say to them, but what are you doing for me? How are you going to help us? And pushing on them, because it's such a barrier, and driving the change to get them out of office, get people in who are going to care about this if they're not going to do it, and flip the Senate at the same time, so that our senators here can drive the change in partnership with the House.
Awesome. Thank you so much, Representative Liz Ryer. Right now, I think Senator John Marty has just joined also on right now, and I'd like to give him a minute to introduce himself. Senator Marty, maybe a little bit about your founding of this idea and how support has grown since.
Sure. I was able to listen in earlier, though I was on my phone while driving home. But no, I'm just pleased to have, it's been a long time building, but now from HCAM and the nurses and others pulling together a coalition outside of the Capitol, and then four of you pulling together a coalition in the Capitol to make sure it happens. I'm convinced, I can give you 1,000 reasons why this is never going to pass. And I can give you 10,000 reasons why it has to pass and why we're going to pass it and so on. And I'm tired of so many folks who say it's never going to happen. That's a self-fulfilling prophecy. And I saw one of the questions, how are you folks going to keep up there when veteran legislators tell you to give up? And I'd say, well, first of all, there are a lot of veteran legislators who want to keep it happening. And the point is, now we're at a stage where we can't afford to not do it. I mean, every time we hear horror stories, Rose Roach always is very good at forwarding all these horror stories about how bad things are. And that's what we need to keep seeing, because that's why we're involved in this. We care about people's health. We're not proposing this in order to save money. It happens to save money. We're doing this to make sure people are healthy. And that's what matters to everyone. And I'm very much more hopeful. I think the new crop of legislators coming in, not just the four of you, but so many others, it gives me real expectation. And yes, Representative Bolden contacted us earlier today saying she's got a hearing on that. So I'm very much looking forward to discussing that, because when we tried the floor amendment last year in the Senate on the Health and Human Services bill to get a study, and Republicans, oh, this costs too much, this doesn't work. I said, why don't you get us off your case then? Just give us the study of it and so on. And if you say it costs too much, then we'll go away. But the reality is it's cheaper than what we're doing now. And I think it's more humane for medical practitioners who get to practice medicine instead of filling out bills and billing people and collecting things and all the other paperwork. We want a system that works for people's health, and that's what we're trying to do. And when I heard you saying, yeah, I see now 117 participants, it warms my heart. And we got some great leadership here, and I'm sure we're going to make it happen. I look forward to discussing that later. Thanks.
Breaking my own rule about busting in, but I see Austin has made a comment. Senator John Marty was running on universal health care before Bernie Sanders. That might be true, right, Senator Marty?
I've been in office longer than him, which is scary, but
I'll step out.
I've been working on single payer for a long time, and for people, I mean, the other thing they'll see, and I think the leaders of the MHP caucus will hear the same thing. Oh, you guys, if you can't get what you want, you don't do anything. You're just you got to have your way or the highway, your way, ideal or nothing, and so on. I keep thinking, hey, I've been there. I was there when they put together Minnesota Care, which was a step forward. But again, it was supposed to be universal health care. I was there during the Affordable Care Act, and that was going to be universal health care. And we're no closer to it than we ever were. Still roughly the same number of people who don't have coverage, and growing number of people who have coverage but can't afford it. So yeah, we'll keep going. Thanks.
I think it might be helpful for us to talk just a little bit before we go to sort of an open questions and that sort of thing, to talk a little bit about, we have a lot of questions about efficacy of like what we think would be and is the most helpful. And I can just offer like very quickly, I would say to everybody that is on this call, number one, the work that you are already doing, it is working. It is working. You have legislators who are coming into the legislature now, who are running on this, who have heard what their constituents and their neighbors and their community is asking for, and we're ready to do this. We're moving forward. So keep doing the things that you've been doing. One thing I would say, I saw a comment about, tabling at a farmer's market, things like that. I think that's fantastic. We've talked also about doing sort of an inside strategy of doing some barnstorming and holding forums around different communities. And somebody asked about a schedule for that. That's to come. I think all of us are we just started our first week or so back here, and we're all super busy, but I think that we will be putting together a schedule here shortly, and we'll of course keep you updated on how that's shaping up. Another big piece that has been happening that we'd like to see continue is that some cities and municipalities are starting to pass some resolutions, and there have been in the past too. I think St. Paul had one in the past, but my city of Duluth passed a unanimous city council resolution in support of the Minnesota Health Plan. The community of Osseo also passed a resolution in support of the Minnesota Health Plan, and this just connects into the piece that I'd really like to see us work on also is focusing in on that fiscal responsibility piece for our municipalities, for our state, that, for too long, this has been viewed as a sort of bleeding heart liberal, socialist sort of program. Even we heard Senate majority, the majority leader the other day asked a comment about this, and he called it a big government program or something, big government socialist program or something like that. And of course, all of you who are participating, that they can call it all sorts of names, but this is a very pragmatic, fiscally responsible, morally correct thing to do that as John Marty said, we have to do it for so many reasons, but it's good for business, it's good for individuals, it's good for our fiscal health of our municipalities and our state, and of course it's good for healthcare, for actually getting people the healthcare that they need. So there's just so many reasons that people might say are more traditionally conservative reasons for moving this forward. And I'd really like to see where we can to really get in and engage with the people who hold what they consider to be more traditionally conservative views, and really engage them on those reasons why this is what we need to do moving forward, that this is the most responsible thing that we can do for one another in community. So I'm hopeful for that.
I think centering the patient-doctor relationship, the employer isn't in the middle of it anymore. The payer's not in the middle of it anymore. They're not making the decisions. When I was on the payer side, we used to joke that we were the fall guy for the employers because they were making decisions to limit their employees' healthcare, and then say, "Oh, those insurance companies." And it's like, no, it's the whole system doesn't work for people. And in the employers and in the companies that are hiring the people, and in the state government, the cost of administration, layer after layer after layer of selling health insurance, setting up health insurance, administering it, that could be a whole night in and of itself, because the costs are really high. And that's where I want to caution when we're doing a study. My observation has been that often the costs get counted and the savings do not, and especially the savings that are one step removed. And we need to be really demanding and rigorous about quantifying and capturing all of the costs that are dragging down our economy and dragging down individuals to government. All the full spectrum is getting affected by the cost of healthcare. And so, but feet to the fire in terms of defining what the study looks like.
Yeah, I think that's so true, and I really appreciate that point. I think too, I would just underline the complexity of the system we have now. I think back to that just sort of relational organizing, and just having those individual conversations and making it close to people, making it real for people. And you talk to people, as was said, everybody has a story about how opaque and complicated and difficult and broken our current system is. Everybody can relate to that. And so just sort of unpacking that and talking about that, it doesn't have to be that way. And, what we currently have just is not working for so many people.
I have saw a couple of questions too about the members of the Minnesota Health Plan Caucus, and are we being selective? Do we have certain rules about who can join, things like that? We don't. It really is, we did outreach in the House and in the Senate with the formation of the caucus, inviting people in, and then put together our statement of purpose, and then made sort of a final, not a final, but before we announced a call out who wants to be included in this initial list. So we are very open. We've had a very open approach about who wants to be involved and to what extent they want to be involved. And then the good news is we have almost 60 legislators who want to make sure that their name is associated with this new caucus. That's very positive. And I think people have different philosophies about how to approach putting pressure on legislators and what that looks like. My suggestion would be for constituents to engage their legislators as much as you can, and also just to really impress upon them and to focus your organizing as much as you can on just building the support within the community, that groundswell. Because oftentimes, before I decided to run for office, one of the more astute things that I learned, and I still sort of live by this, is that in many instances, political leadership follows rather than leads. right? Unfortunately, there are some leaders in politics who do get out front and lead. But oftentimes many politicians like to sort of keep their powder dry and they play it safe. So if they see that the community is demanding this, if their local city council is passing resolutions and there's a forum happening and there's meetings all the time and many people are asking them about this, then we're going to see movement. We're going to see movement from that. So I wouldn't necessarily use it as a hard litmus test. I guess it kind of depends on who your person is and how close it is and all the different issues that are happening. But keep asking those questions. You know, I think keep asking, like, why aren't you, are you supporting this? Like, this is something that I support, here's why. You know, really talk to them about the reasons that you're doing it, encourage them to get on board with it.
And you're muted.
Thank you, Senator McEwen, for that. Our question was specifically, we wanted to make sure that we were free to kind of lobby our elected to both be part of the caucus and to be co-sponsors of the bill, or one or the other. Were you trying to keep the recruiting for the caucus inside your leadership? You don't mind if we kind of lobby? Okay, that's all right.
Yeah, please
And
do.
then,
I just meant to communicate that it's the most important piece is the organizing that so many people are already doing.
absolutely.
And the legislators will follow, but it does help to have that recruitment.
And we understand that you're going to be setting up a website so that we've gotten lots of questions about who's currently on the bill, you know, and who's currently in the caucus. So we understand what should we look for with that kind of information from the caucus.
I'll let Jen or Liz speak for the caucus, but for the co-authorship and so on, I think we have 23 in the Senate. In the House, in the past, we've had like 45. I think we're only about 35 now. And I know some of the people in the House have been on the bill, but didn't sign on this time. So it seems to me it's worth recruiting them and recruiting more members. But that's something the more HCAM folks can do, the better. When somebody signs on, it might be just so they get some constituents off their back. And okay, I'll sign on, but I'm not really supportive of it, kind of thing. But don't worry about that. Right now, we'd rather have them have said they support the bill. One illustration: the two of the former members of the Senate DFL caucus who became party members, who were both co-authors of the bill. I asked both of them this year when they switched party, or last year when they switched party, if they'd still co-author. Tom Bach said no. David Tomasoni said yes, but then when he heard, because we only have 5 authors in the Senate, so we have to have clone bills. We have like 4 bills numerically in a row that are all Minnesota Health Plan bills, because they couldn't only have 5 authors. And so Tomasoni said, well, I only signed on the first bill, and so he didn't. And he's terminally ill with ALS, so he's going to be leaving the Senate, unfortunately. But he was one who, to his credit, even though he was becoming independent, said, no, I'll sign on to that. And he had an excuse for not in the end. But the bottom line is, a lot of these folks really do mean it. And a lot of others, well, I did it for that, and then, oh, how do you get out of it? I said it was for this, and ask them, why do they want to get off of it? But the other thing I'd say, because we're dealing a lot with, we're trying to get this year some progress on Liz's bill on the cost study. We also have one that we've been pushing hard, or beginning to push hard. That's one to deprivatize our public programs, kick out the health plans for Minnesota Care and Medicaid, and deliver care directly. And by doing that, we actually save money, and we can use some of that money to give the community health clinics, give them dollars to hire nurses and outreach workers to go bring in people who are on the street who have severe mental health or other challenges. So, it's a very important thing to try those bills. But we also have to be careful. I mean, I'm concerned that there's a quote public option bill that people, oh, that's a good step forward, and I don't think it's a bad thing to do, other than I think it's going to put us off for 10 years, because, well, it take 3, 4, 5 years to get that passed. if we get it passed. I think that's harder to pass than this in the long run for a variety of reasons, but we get that passed. It doesn't cover everything. It doesn't cover everyone. The maximum number of people who could be in it's about 7% of the population. What about the other 93% who can't afford the co-pays, the deductibles, everything else? So I push against that, saying, because a lot of Democrats, I talked to one freshman House member 3 years ago, and I said, I'm not opposed to it, but it only covers 3% of the public. If you include small businesses, 7%. And he said, you mean we spent our whole campaign talking about a bill that will cover 3% of the public? And so I think we have to try and push what we're pushing, namely universal healthcare. And the best way to respond to that is, okay, you got a different proposal. Does that cover everyone? Does it cover everything? Does it avoid co-pays and deductibles? Does it do any of that stuff? And frankly, none of them do. And I think we'd all sign on to another bill if they had a bill that they thought was easier to pass. It would do all these things, but none of them do. Rose
I'm
sorry, go ahead.
Should we, Senator McEwen and Representative Bolden, should I let our hosts go ahead and start working through the questions?
Yeah, we can go ahead and do that. I just
Is
wanted
that
to
okay
point
with
out one thing beforehand, Anne.
Mhm.
Senator McEwen had not put in the chat, but had spoken about city resolution advocates and county resolution advocates. If you want to become a city or county resolution advocate, please email us and we'll get you connected with other people in your area. So you can email us at info@hca-mn.org. And now we'll start some questions.
Thank you.
Could I just jump in before you do that? I think we're going to say the same thing. There was a question about a web page, and will there be somewhere listed that has all the caucus members, and that is in the works. So stay tuned, and we will certainly share that web address when it is ready soon.
Great, awesome. First question: what techniques of legislative outreach from constituents have you found particularly effective?
Go ahead, Liz. Do you
sure. I think, there's a number of ways to reach out to people. I think just the more, the better. I think, contacting via email is certainly useful. If you contact your senator or representative via email, be sure to include your address, because I know, our top priority will be those who are in our districts. And so that'll sort of bump you to the top of the list if if we know that you are one of our constituents. And so, certainly email is important, phone calls, requests for meetings. I mean, I think all of the above. And I think it's like the persistence is important. So even if you, contact somebody and, they're not for it, don't just let it be at that point. Keep asking about it. And I think that what was mentioned earlier of, okay, so what is your plan? What are you going to do? Is a great question, because there's not another really good answer to that. And so I think just, communication is important and persistence is important.
Yeah, and I agree. And I would reiterate too, that I do think politicians will often just take notice when they see that you're building power within their district around an issue. So one of the best ways for you to get their attention is to be having big meetings, to have a big coalition going, to show up to different events, you're tabling, you're just building that power through organizing within the community. And pretty soon they don't have a choice. They're going to come to you asking how they can help.
Excellent points. Next question. Much of the resistance to the Minnesota Health Plan comes from rural Minnesota. How are we going to reach out to them and tell them how important Medicare for All is, or the Minnesota Health Plan?
If I could comment on that one, I'd say that I have a different impression of that. I have rural legislators who have more pushback, but it was interesting in the past, when we first started working on this, when we had a lot of Democrats in greater Minnesota, they were the first ones to sign on. Guy who represented area near Alexandria and Otter Tail County and that area of the state, he was not expected to win. He was an upset winner. Our caucus was unaware he was coming because they didn't think he could win. They didn't help him at all. And when he was asked by Eileen Weber, who is on the chat, I see Eileen asked him to sign on as a co-author, and she must have talked him into it because he signed on. He came to my office next day, threw the bill on my desk, said, "What's this about?" And I explained the bill and said it would cover all his convenience store clerks, every farmer and everybody. And okay, and what's it cover? It covers everything, and okay, and it's based on ability to pay, so it's affordable to everyone. And he says, "Yeah, and well," I said, "What do you mean, and?" Well, why should we not like it? Why wouldn't we like it? And I said, "Well, they'll call it this, and they'll call it this, and they'll say it's too expensive and everything else." And he said, "Okay," and he walked away with never taking his name off the bill and was a strong supporter. I think the rural folks have worse problems with healthcare access. Their hospitals are closing. They have to drive further. Their costs, especially in some parts of the state, are far higher than anyone else. So I think it should be easier, and that's the pitch we have to make. But we also have to do this huge outreach to business, let them know how much hassle it takes away and how much cost it takes away.
I think too, what I would add to that is, as we just mentioned briefly, I think earlier, some of these barnstorming events and you're sort of taking the show on the road, if you will, and having some rallies / sort of educational forums all around the state, because I think certainly there's a sector of the population who just is not aware of MHP and doesn't yet know that they support it and love it. And so, but certainly would once they hear about it. And so, and sort of dispelling some of the rumors and just making clear about what it is and what it isn't. I think that educational piece will be important. And then just helping to build that power and momentum, across the whole state.
And that's where we're going to be leaning on all of you, especially as we put our plans together for the spring and summer for these barnstorming events, because it'll be very important for us to have, as much as we can, people within those communities or who have ties, who are connected in some way, who already are on board with this and who are going to come together and tell all of the community and shout it to the rooftops how great this is and how important it is and how this is the best way forward. So that is what we're going to be looking for, and we'll sort of put out the call with your organizations and with individuals to sort of say, hey, who do we need to bring in on this throughout Minnesota? Who needs to be at these barnstorming, these forums, these events? So we'll be looking for help with that too.
And we'll be there, happy to help. Next question. What happens to the Medicaid population under the Minnesota Health Plan? Are they included or left to fend off Medicaid as state recovery? Any plan that doesn't eliminate recovery is not equitable or just.
They live in Minnesota, they're covered.
Yeah.
100% for everything. Medicaid is a very good program. They have trouble getting providers to cover them sometimes because they reimburse at lower rates for dental and things. But no, we cover everything they have. That's the whole point of it. It's the best analogy I have is compare it to elementary school. When your child turns 5 years old, they don't have to qualify. They don't have to pass an exam. They don't have to have no health conditions. They don't have to have their parents have the right health insurance plan. They don't have to worry about copays and deductibles. They just get to go, period. And they can go to whatever school they want. And the reason we do that is because we want every child to get an education. But we sort of think every person ought to have health care too. So yeah, they're covered. Everybody who lives in Minnesota is covered.
And I think that it may be that the person who's asking the question has, because there are some instances with people qualifying for Medicaid and for federal programs where they have to sort of spend down and make sure that they meet those income limits. Unfortunately, the federal government is the federal government, and at the state level, we can't tell the federal government how to make things right for the things that they've done with their programs. But like John said, it would be going forward, every Minnesotan, every person who lives in Minnesota would be covered under the Minnesota Health Plan. So that would be a game changer. For
waivers are gone.
Situation
so is the
forward.
TEFRA program, and all those things are gone because we're covering.
Yeah.
Excellent. Next question. For example, what effective model advocacy campaigns would you recommend for us to learn from? Oh, wait, I'm sorry. That was related to a previous question. And for some reason, it just popped up. Sorry, next question. What happens? For some reason, I have questions re-popping up. I apologize.
We did sort of jump in and answer some of them here and there.
Yeah,
so it's
well,
our fault.
well, unfortunately, I had put some in the answered, but unfortunately, they're popping back up on my open. Sorry, apologize. Next question. Is making the Minnesota Health Plan a ballot item possible rather than waiting for the Senate to flip, some Republicans to change, or large businesses to jump on board?
We don't have initiative and referendum in our state, and it would be an awfully difficult thing to do something like this through that, not because of lack of support, but just because there's so many details you have to work out. And if something changes, because something on a huge, it's 1/6 of our economy, something changes in it, and all of a sudden, well, we've got a ballot initiative. It wouldn't be the best way to do it. But bottom line is we have to change the politics. And I'm encouraging people, HCAM or other activists around the state who care about this and want to do advocacy. And what they do, they sign petitions, they go to events, they participate in social media, they do this. Hey, maybe they want to run because we got a whole lot of districts where we could use candidates. And hey, you can talk full time about this. I mean, in 2006, one of the reasons when we came in with the Minnesota Health Plan after that was there were at least 2 candidates who nobody thought was going to win. Or one of them they thought people could win, but who came in here saying, oh, they had talked to, I guess, Kip Sullivan or others, and they were sold on single payer. They came in talking to people. One of them in Bloomington beat a longtime 20-year Republican incumbent, talking door to door about healthcare for all. And so I'd say we need candidates in some of these areas who are willing to talk about it. Some of them are races that we're highly probably not going to win. But heck, you use this and a little bit of effort, you get public money and so on to be an advocate, a campaign who's advocating for something you believe in, universal health care.
Yeah.
I would add real quick too, that this sort of goes to this idea that what I'd love to see is I'd love to see us sort of move the ground underneath Republicans' feet, right? I mean, we have this sort of politic right now that is so divided and so extreme on the right, at any rate. And I think that though, if we do that grassroots level organizing, like another issue that I wanted to raise is it could be really helpful, I think, for people to get involved with the sort of organizations and institutions that you are a part of, apart from this right here, right now. Like I would give the example when I was running for office, a number of progressive organizations would ask me in their questionnaire or in forums that they would have, do you support single payer or not single payer? Do you support a public option is what they were asking me. They were asking me if I supported a public option. And I was trying to tell these organizations, like, my constituents, I think, are way out ahead of where you are. Like, I support the Minnesota Health Plan. And so do the people in my district. So that's what we're asking for. That's what people want. So I think sort of changing that dynamic of the organizations that you are active in, talking to those people in those organizations about, like, this is where the momentum is. This is where we're moving. Let's start asking people about this. Let's start working on this. So, so yeah, that's a huge part of, that's a part of like moving the ground underneath the power structure's feet so that things are moving and then the power structure is gonna follow.
Next question kind of relates to that. What established groups in each of your districts are on board for the passage of the Minnesota Health Plan?
It's a great question. My whole city, it seems, is in Duluth. I'm like a large section of Duluth is. And I mean, I brought it up to a group of the Churches United in Ministry in Duluth. CHUM is an organization that provides a lot of aid and help to people in the community who are struggling economically. And I've sort of raised this with them, that I'm part of this caucus and we're doing this work. So that's what I'm talking about, like different organizations. But in my own community, it is because of the work that some of the people who are probably on this call right now have done. The education has been there, and they've raised awareness in the community to a point where, you know, our entire city council votes unanimously in favor of wanting to, you know, calling on our legislative delegation to move this and do it.
Yeah, I think just so in terms of my district, we're not quite as far along, you know, from the city council aspect, as Senator McEwen said, and certainly if there's folks from Rochester watching, and you know, there's opportunity there with our city council, but certainly, you know, in Rochester we are a medical community. I talk to nurses every day, and they absolutely understand, you know, the need for this, the importance of this, the urgency of this. And so there is wide support in my district for that reason as well.
Love to hear that. Next question. Does the Minnesota Health Plan have a mechanism to cover Minnesota residents who are students and are going to college in other states? So this person says they're from the West Metro, but go to school in New Hampshire. How would they be covered for healthcare in that situation?
Yes, the Minnesota Health Plan is written in a way that would cover them. The difficulty we will have with all this, because again, to make it sound, which the opposite of what I want it to sound like, but it is a difficult challenge to pass. After we pass it, we do have to get some federal waivers to make some things happen. But we would be covering people who live in Minnesota, or people who are residents in Minnesota but temporarily out of state. In other words, if they really live here, their parents are here or whatever and so on, we would have that covered. But again, part of that becomes the negotiations with the federal government to make sure we get it. We believe everybody should, and we also do cover, if you're an employer, a Minnesota employer, and you hire people from, say, Hudson, Wisconsin, they come and work here, they could, the employers would be paying the payroll, the tax they have on employers, which would be less than they're spending now, but it'd be the cost to employers. They'd be paying it. And if employees who live in another state but work here, they could buy into the program the same by paying the premiums that way. So we're trying to cover it. You go south for a couple of months in the winter, you're covered. You go to college, the plan is to have you covered. And we shouldn't back down from that, but I'm just telling you that part of that ends up in the negotiations with the federal government.
Sure, that's totally understandable. A little complex there, but next question. How can we go on the offensive to counter the words that get lobbed at the quote liberal big government program? Any ideas? The tough one.
I'll answer, but I wanted to see if the other two wanted to first. So my answer, go ahead, Liz. Oh, okay. Well, my answer would be simply that, first of all, that what do they hate about liberal big government programs? Well, they don't want government telling us what kind of health care we get. And I'd say when they've said, oh, this is a couple of years ago when we introduced it, several years ago when Trump was first elected, we introduced it. We weren't going to have a news conference, but we had so many people sign on and they said, let's do one. So we did. I predicted the first question was going to be, didn't the voters just reject socialism and this? And how come you're offering this? And government interference in healthcare. I said, this doesn't have government interference in healthcare. It says government financing the healthcare system is less interference from government than the current system, less interference from insurance companies than the current system, less interference from employers. People who make the decisions of who you go to are you. Which doctors, clinics, dentists you go to is up to you. Who makes the medical decision? You and your medical professionals. Not some insurance company with prior authorization, not the state, which does it too. In other words, if we want a choice of the care you get and you want to decide it with your medical professionals, this is what we do. This is not a government-run healthcare. What we now have is an insurance, employer, and government-run healthcare system that you get some say in. And we're replacing that. So the bottom line is it's less intrusive.
I think that's right. And I think just calling that out and just, the truth is that really just isn't what it is. And so, the truth is right now, it isn't, providers and patients who are making decisions. It's insurance companies who are making decisions, or, that coverage, whether it's a medication and the prior authorization, or whether it's which physician I can even see, which one is in network or not. There's all kinds of decisions that are not in a patient's hands right now.
I like that a lot too. And one of my favorite things to sort of riff on, and I'm going to try it out. We'll see how it goes when I'm going on these barnstorming things. But I like to talk about the freedom aspect of what we're talking about. Like right now, it's very oppressive, the system of healthcare, the way that it's set up, going to what Representative Bolden and Senator Marty were saying. Like, you don't want some corporate executive deciding whether or not you can have a procedure. That's what's happening right now. And so we have a program where you and your doctor are literally going to decide what's going to be best for you and then decide to do it or not, like based on healthcare decisions. And so it'd be a game changer. And then it connects also into, I like to talk about how it would separate healthcare from employment status. That's a really big deal for a lot of people, and a big deal in rural areas too. Like I know a number of farmers outside of Duluth, the farmers who run these CSAs and things like that for people who live in Duluth, and they bring in their produce and whatnot. And oftentimes they're running a farm, and one of the people, as part of the family, has to have an outside job and has to keep it, even if they don't really want to be doing the job. They're just tied down to it so that they can have health care for their family. And that happens, in so many scenarios. People are tied down to jobs that they don't really want to do, that they would be doing other really exciting work that they're passionate about, except they can't because they need the health care. So to free people up, it really is so much about freedom for people, literal choice and freedom for people of their economic choices and their work choices and their family choices. It's just, it would be so freeing. It would be a game changer. And I actually think if we institute it in many ways, it could be a kind of economic renaissance in many ways, because we would see people so freed up economically to do the kind of work they want to do.
And then when I said earlier too, because we all talk about the insurance companies' control, but government does have a big. The State Department of Human Services was requiring prior authorization for a opioid antagonist drug. They were requiring prior authorization for it, and that can kill people. It's a terrible policy, but government shouldn't do that. But the other one is the employers. We all think of Hobby Lobby because they were telling its employees they couldn't get reproductive health care. That's not just the Hobby Lobbies, it's Alina. I mean, they asked the nurses, they went on strike about Alina because Alina was saying, we won't let you keep your health plan. We want to do it where you go to the doctors we tell you, you go to the services we tell you, we're going to do it your way. Even though the nurses were paying for their plan, they were taking that instead of wages. And over the years, then Alina came and stepped in, no, we're going to tell you who you can go to and everything else. And so it's not just the Hobby Lobbies, it's the Alinas of the world and almost every employer.
So true. I'm going to invite the rest of our panel to start their videos again, and we can continue this conversation while maybe Judy and Jen, so that we're not disembodied voices, Judy and Jen can kind of take a look at the rest of the questions while we still have Representative Bolden, Senator McEwen, and Senator Marty. Got just a few more.
Can I make a comment? I just thought of something that I wanted to add to a previous answer or comment. In regard to like our caucus members, we get to see a lot of questions about that. If you find out that your representatives and your senator or your electeds are part of the caucus, please, if you can, thank them for joining. But also, this is an important piece that I wanted to bring up. Don't just assume then that means that your representative or your senator is going to be actively working and fighting for these things. Because I do think, what we had seen, and part of the reason we formed this caucus is because there are a number of people who have it in in elected office who have sort of a idealistic support for this. Like in theory, they think, well, sure, I guess, but they're not really ready to get down there and push and use power to move it. So that's a big difference. I know, my predecessor was in support of this plan, but when I ran against him, I sort of called him out on not being active enough to push for the plan, to work for the plan, to make it happen. And we see a lot of that. We see a lot of people who say, oh yeah, I support it, but they're not going to use their own power or their own influence to actually move it forward. So when you get that yes, thank them, but then ask them how it's going and what are they going to do and how are things moving. Don't just say that then it's over.
That is such a good point. My language around that is ask your representative for your state senator, what can I do to get you to be a champion for this bill? Because that's the next level. Yes, just signing on is not good enough. Say, Judy and Jen, I see someone, I don't know if this is dangerous ground or not. I see someone, Eileen maybe has asked, is Governor Walt supportive of the Minnesota Health Plan? Anybody want to take that one on?
I think the governor has said he would sign it if it gets to him, which
that is
is
not being a champion. Okay.
That's not what you call being a champion. We could use more help from him. I met with him and Peggy Flanagan several times before and his response at the time was, well, this would devastate the VA. I said, no, first of all, we would, federal government may not let us touch it, but if they do, and even if they don't, we'd be covering the same things they do. We'd include the VA in the system if they let us. But he was using that, I think, is more of an excuse. I was disappointed in that, but I do hope we can. He does give in to pressure. He just doesn't always read where the pressure is really strongest, and I think we have to make our pressure stronger than anybody else, and he'll be with us then.
Going off of that as well, for other new people who may be joining the legislature in the future, we have a question. I'm a declared House candidate in Northfield. Is there a way for candidates to officially sign on or show support for the caucus in hopes of joining once they are in an official capacity?
That's a great question. And I'm so glad to hear that. I think so, in terms of the caucus, I think, correct me if I'm wrong, I think that is, restricted to current electeds. But I think it's, certainly fair to use that, on the campaign, as Senator Mcewen said that, she ran on this. So I think, chalk it up as much as you can, at the doors and at events and all the spaces where you are, to make that clear, which will help, in a couple of ways, both, to make your views known, and secondly, to help to raise the awareness and, presence of the Minnesota Health Plan is, for that organizing and building power, it'll be win-win.
I am so glad to hear that somebody is, and I think it's sort of in some ways in certain areas of the state right now, this untapped in some ways enthusiasm, because I think that there is on the doors when you're talking to people, we all know this, all the people on this forum, this is what people are asking for. This is what people actually want. So if you are bold and forward facing about your active support for this and moving it forward, I believe that is a winning political message in many ways. So I applaud you for jumping on board. I think it will help.
And can I just say that in the comments, Henry said that in his community, he gets pushback from healthcare professionals who are worried that Medicare for All or the Minnesota Health Plan would threaten the viability of their institution. Is this fear real or overblown? Help me argue against this fear. It's overblown. That's for sure. Feel free, I'll open it up to the legislators to talk about why actually the only way we save our community hospitals, particularly in any kind of rural areas in the state or in this country, is if we institute this kind of a healthcare system, because we will be operating with budgets, global budgets at the hospitals, and it will be based on the needs of the community and not just where Mayo or Essentia or M Health Fairview decide they want to put a hospital or close a hospital just based on their bottom line. So it's much more real when you have a system like this, because it is based on regional community health needs, not on, you know, just the greed of these companies that are supposedly nonprofit, which is a misnomer in healthcare, doesn't exist. It's just a tax status, and it means they're not paying their dues to all of us for the privilege of, you know, working and serving in our community. And it's frustrating as can be that is the case. Trust me, they're sitting on boatloads of cash in reserves, and we know where it is. It's even offshore in the Cayman Islands. So that's just very disturbing. That money should be going to healthcare.
Tell us how you really feel.
And I see a couple. Yeah.
Are you seeing a couple questions?
Yeah, I wanted to comment. One person said they don't know of any country with single payer allows free choice of provider. The price single payers, so rich people can always find a provider. Well, the thing is, we're covering everything for everyone, and if people want to go outside that and pay something else, they can. But the point is, we have to. Our bill requires the health plan to meet all the needs, which means getting more providers, not saying we're going to chase providers away. I just find this offensive when the opponents always say that, you know, you guys are going to pay at much lower reimbursement rates. You're going to pay at Medicare rates, Medicaid rates, excuse me, and you're going to drive people out of business. We're not going to drive them out of business. That's what negotiation is. When you count all the money you save from price negotiation, where some hospitals charge 16 times for a knee replacement, what other ones do 16 times as much, not 16% more, but 1,600% more. You know, you get rid of those things, and you can pay a fair rate for everybody, and you negotiate that. And the other one I want to respond is what about multiple chamber of commerces? We actually had a chance a number of years ago. We spoke at some small town chamber of commerces. We tried Twin West Chamber, which is one of the biggest in the state, let us do it. And then the week after that, they canceled it because they had something else come up. So we never had a chance. Chamber of Commerce, there are a lot of businesses who would benefit, but the Chamber of Commerce represents all their members. And that includes insurance companies and pharmaceutical companies, and they will not divide themselves. So they will stand. I think it's good to take a chance to speak to them anytime you can. I don't mind speaking anywhere. I think all the legislators here would be happy to. But I don't think it's not the chambers itself we're going to win with, maybe some small ones. It's mainly going to be individual businesses who aren't insurance companies wanting to do it.
I think I see a couple questions about how we're going to control drug prices, and just that kind of gets to how we run a health fund and a state-based health plan. You want to speak to that a little bit, Senator Marty?
Sure, I can. Rose often does this too, and I think Jen and Liz can too. But bottom line is, what we would have is a pool of 5,000 people negotiating. And one of the reasons our drug prices are so high is pharmaceutical lobbyists bought control of politics. And the U.S. Congress, when they passed the Medicare Part D, they actually prohibited the federal government from negotiating prices. That's why drug prices for Medicaid are the cheapest anyway, because they negotiate. And for Medicare are, you know, at the time, Congress basically said, we're going to buy drugs for all our seniors now. And pharmaceutical companies tell us how much we should pay you. That's a really good deal for the pharmaceutical companies. And of course, the congressman who wrote the package and was chair of the health committee at the time, he resigned a week after the bill passed and took a job, $1 million a year, 20 some years ago, $1 million a year working for pharma. That's corrupt. We're going to negotiate prices on things like that. It would be best if it was done at the federal level, but we'll do what we can at the state too.
We have about 12 minutes left. I need a couple minutes at the end for some announcements, and I think I would like Ken to talk a little bit about the work we're doing to bring groups together to press this forward. So if Senator Mcewen and Senator Marty have last thoughts for us.
Oh, just thank you so much for having us today. It's and mostly thank you to everybody who's on this call who is doing the hard organizing work. You really are the people who are driving this. And I just thank you so much. The only reason that I'm a senator is because of being inspired by the people who are doing the work. So you do inspire me, and I hope that we keep on going, and I think that we will do it. We have to succeed. We will succeed. So I really look forward to our work together and to the momentum that we're building together. Thanks.
And I'll just say thank you as well. Both the HCAM has been growing and gaining in strength, and the nurses are pulling in so many other unions involved in this. And all HCAM and the nurses were saying, we need a legislative caucus on this. It was, idea came from there. And yeah, I talked to a couple people and they said they were glad to take this on. And we got 4 wonderful leaders and a lot of good caucus members. So I'm just so excited to see it all and very grateful as well.
And we value our partnership with Physicians for National Health Program Minnesota, because we need to get those physicians on board and those hospitals. And we are we're working really hard on, just so you know, the small business community and labor and activist organizations. And Ken's going to talk a little bit more about that next up. And just so everybody knows, we are really going to do a lot of education on messaging. We know that it's tough to talk about this issue. So keep tuning in, because we keep trying to refine and get better at how we talk about this issue. And it also helps to volunteer to talk to the public, because you actually learn a lot when you start trying to explain and learn their problems and so on. So look for volunteer opportunities. We expect to be working kind of hard. So we're with you. I mean, we are excited to have the champions inside the legislature. Honestly, this is a very big step forward. Yeah. Okay, so Ken, maybe you could just talk a little bit about work that we've been doing with other organizations in Minnesota to build a coalition to support a campaign for a bill.
Yeah, hi, everybody. Thank you for your attendance tonight. I'm Ken Engelhardt. I'm a retired internal medicine physician with 35 years of practice experience, 25 in the private sector and 10 at the VA here in Minneapolis. And while at the VA, I was clinical co-chief of the section of general internal medicine. So I was involved in the running of primary care clinics. So I've seen both the private and public parts of this. I'm on the HCAM board, and along with Rose Roach, I'm co-leading our Coalition Builders team. I have the good fortune of working with 10 other people on that Coalition Builders team, and these folks serve as liaisons to our health justice ally organizations. We have 20 health justice allies that have attended at least one of our health justice allies meetings. We've had 5 such meetings, and the various organizations are pretty diverse. They belong to either the business community, represent rural Minnesota, progressive advocacy, labor, Latinx, LGBTQ, and physician organizations. As an example for business, Main Street Alliance. As an example for rural Minnesota, the Land Stewardship Project. As an example of progressive advocacy, I would say Take Action Minnesota, labor, of course, Minnesota Nurses Association, but also Education Minnesota are just 2 examples. We've had COPAL for Latinx. We've had Rainbow Health for LGBTQ, and PNHP Minnesota, of course, is one of our key partners and working with the physician community. And we hope to grow our number of health justice allies. In fact, we're going to be reaching out soon to at least 6 more health justice allies that are potential allies, I should say. These would be groups such as health professionals for a healthy climate, ARC, NAMI, gender equity organizations, this type of thing, and potential other labor organizations. Our strategy has been mentioned. It's the inside-outside strategy. And this is one that has been used before with labor campaigns. The most prominent one I know about is the effort to organize after years of struggle, the successful organization of the meat factory, large meat factory, Smithfield in Tar Heel, North Carolina. They use this inside-outside strategy. So the inside part is what you just heard about from the legislators, and the outside part are the grassroots organizations that I've mentioned. And just a quick update on where we stand as far as the legislators' involvement. I got an email yesterday with kind of the fluctuating numbers because not all members have had an opportunity to say whether they support the Minnesota Health Plan or not. But the list as it stands yesterday, names of current Minnesota Health Plan caucus members, we had 24 senators out of 67. So that represents 36% of the Senate. And we had 35 out of 134 Minnesota House representatives, or 26% of House representatives. So just a couple other things to say. If you know of any organization that would like to partner with us and join the coalition, please write to Healthcare for All Minnesota and let us know, especially if you have a contact person that we can speak with and explain what we're all about. And we'll be keeping you posted, and I'm encouraged by the progress we made. I feel momentum. I see youth joining our organization and our movement, and it's just an exciting thing to see. And I really think we can get this done. It's obviously the right thing to do. So again, thank you for your attendance.
Thank you, Ken. I'm going to share my screen for just some final thoughts, I guess. We did a program a year ago on sharing a documentary on racial health disparities, and it was, let me see if I can find my slide on that. And I'll just quickly go through this, a few pieces of information here from about a year ago. The shameful situation of racial health disparities and really segregation in our healthcare system. And a lot of people don't know, I certainly didn't know, growing up in Minnesota, that our healthcare system was literally segregated until the passage of the Medicare and Medicaid Act of 1965. So we have a lot of work to do because we still have racial health disparities to a shameful degree amongst communities of color, but also amongst lower income earners and rural areas of our country. I just want to say, in recognition of Black History Month, and persons of color in all disadvantaged communities, we invite you to imagine a better way. And we want to be inspired by Dr. Martin Luther King Jr. to reduce or erase the facts around injustice in healthcare. So going forward, I'll I want to share with you this. This is actually a Facebook post from Rose that I copied and put on the slide. And you can copy this. Judy and Jen will send out slides after this session. I haven't really covered everything that I had ready because we were blessed to have a lot more time with our Minnesota Health Plan Caucus legislators than I even expected for this evening. But here's a really quick answer to how are you going to pay for it. And it's, if we can invest this much public money in funnel all this money to private health insurance plans, surely we can afford to cover everyone in this country. If we just reimagine how we pay for healthcare. These are the bill numbers. We are on a dual track toward a national health plan. Obviously, a national health plan would be the better solution. And the current bill numbers in the House and the Senate are HF 1774 and SF 1643. I really encourage people to read the bill. You will feel a lot more confident in talking about this issue if you're really familiar with the proposed legislation. And I don't know that we don't have time to go over the provisions in the Minnesota Health Plan, but please get a copy of Senator Marty's book. Senator Marty not only wrote the bill, but he wrote the book on what is the vision for this proposal. Our job is to bring more people to the fight and provide that grassroots support that our legislators have talked about being so important. We're gonna do more training and more education about having those good conversations. I offer this worksheet as just a way that you could personally keep track of work that you are doing at the grassroots level. And then I invite you to participate in group events that we have and even devise your own. What can I do right now? These are some ideas for what can I do right now. Learn more about it. Knowledge is power and confidence. Continue to show up for our educational events. And then we've got a few announcements before we wrap up. Please go back and review the events that we've put on YouTube over the last year or 2 years. We are making a special effort to ask people to participate and engage in our social media platforms, because that is kind of what we have available right now in the absence of in-person events until we can resume some of those. So those are the addresses and social media platforms that we have. Saturday, March 5th is a quarterly meeting. And that is, of course, virtual, our 9:30 to 11. The focus will be on small business. We're going to have two small business owners, one small business owner talk about what he told a rally on the Capitol steps in January that we held with the press conference for the announcement of the new Minnesota Health Plan Legislative Caucus. And I think you'll find that really interesting and inspiring. And our next educational event will be March 10th. We're going to talk more about the Minnesota Health Plan at that event. We did submit a vendor registration for Twin Cities Pride, which is June 25th and 26th. That is a really big event. We wind up talking to a lot of people on that event, and we need lots of volunteers. And we actually have a plant table at Farm Fest in Redwood Falls in August. But of course, other events will come up in the meantime. And we know that people are doing work in their own communities with farmers markets and festivals and parades. And we hope that the public health situation permits us to do more in-person events this year as we work to build momentum and grassroots support for this issue. So I will just repeat, and I guess you'll see it when you get the slides. One of our most important public programs, of course, Medicare and Medicaid, are part of, frankly, a larger push to privatize and monetize our public programs. Medicare is under particular threat. If you've attended any of our educational events in the last 3 or 4 months, we've made several calls to action to call your members of Congress and Health and Human Services Secretary Becerra to ask him to stop a program that would privatize Medicare. More information on on our YouTube channel if you haven't had a chance to attend those educational events. But we've got the language for these calls to action in the slides. And also please ask your members of Congress to sign Representative Jayapal's letter asking Health and Human Services to halt a program called Direct Contracting Entities, which would privatize and monetize traditional Medicare. Very dangerous proposal. These are the phone numbers and the Health and Human Services comment line. And then I guess I'll just finish with all of what we're doing is about social justice with everybody in and nobody out. In this month of February, I think it's important to remember that it was Reverend Dr. Martin Luther King in his letter from Birmingham jail reminding us that injustice anywhere is a threat to justice everywhere. and we are all in this together. So my contact information, and thank you for attending this evening. Judy and Jen, I'll let you do a quick wrap up.
Sure. Wrap up is very simple. Everyone, thank you very much again for joining us. We will be sending out an email early next week with the link to the recording of this webinar on YouTube, as well as, Anne, will you share your PowerPoints with everyone that we didn't, even though we didn't go through them, will you share it? Because they have the,
Yes, absolutely.
as well as the PowerPoint slides that Anne has reviewed. And if anyone ever has any questions, please never hesitate to reach out to Healthcare for All Minnesota. Our email is info@hca-mn.org, or you can also reach out to PNHP Minnesota. Jen, do you want to share your email address?
I've put contact information.
Oh, okay. Contact information for all of us is in the chat. So again, thank you everyone for joining us, and we look forward to seeing you at our next event, which is the Healthcare for All Minnesota quarterly meeting on March 5th.
Okay, I know there were a few questions we didn't get to, and I apologize for that, but we were so fortunate to have